All right, welcome everybody. Thank you for attending our first wellness webinar on Wednesdays. So we're going to be talking about diabetes throughout this whole series. This is part of our diabetes program as outreach. We're going to meet twice a month to talk about all aspects of diabetes, how it affects your life, your body, and different things that you can do about it. So we'll have different specialists such as the endocrinologist, the foot doctor, the eye doctor, the kidney doctor. And tonight we're starting with nutrition. As Kemal said, I'm one of the dietitians, and with Jackie, our social worker. And hopefully I can get this to move on. Oh, okay. So tonight's topics, as I said, we're starting with nutrition. So we're going to talk about what is diabetes, what exactly happens in your body with diabetes. Can you eat your way out of it? Is it possible to cure it with food? And then Jackie's going to talk about diabetes and mental health. So what is happening in your body with diabetes? What happens when you eat is that food, particularly carbohydrate foods, and we're going to talk what those are exactly, they turn into glucose, sugar, which your body needs, your cells need for energy. So glucose requires insulin to enter the cells. The pancreas, which is located behind your stomach, makes the insulin. So before diabetes is pre-diabetes, and a lot of people don't even know that they have pre-diabetes. So what happens is early on, the cells are resistant to taking more insulin. And so the body just makes more insulin. The pancreas keeps producing because the sugar has to get out of the blood and get into the cells to do whatever it needs to do, give you energy, grow your hair, whatever your body needs at that time. So what happens is your body will make extra insulin to get that food or the sugar out of the blood and into the cells. So in pre-diabetes, blood sugar stays normal because the body overproduces insulin. And what happens when you overproduce insulin, eventually you run out of insulin. Your insulin production starts to decline, and that's what happens with diabetes. So you do produce insulin throughout the day. You make background insulin. So right now we're not eating, but our body is still making insulin to help keep us steady because we still need energy to talk, to move, to think, to watch, to listen. And then when we eat, our body also releases insulin to take care of that food, to go give it immediate needs. So if I'm going to go for a walk and I eat a banana before I walk, I'm going to release insulin right away for that banana to go move it into my cells to give me energy for the walk. So, and I have a note at the bottom of the slide that when you're fasting, your liver releases stored carbs for energy. So sometimes people think, well, why is my blood sugar high when I haven't eaten? I've been fasting, or I'm sleeping overnight, so I'm fasting overnight. And what happens is your liver sends out extra carbohydrate or glucose to fuel your brain, because it can only use glucose to fuel your body. But if you have diabetes, your insulin is not being released enough to get it to where it needs to go. So you wake up in the morning with high blood sugar. So that's why you can sometimes have high blood sugar when you're not eating. Now, food also contributes to high blood sugar, though, certainly, as we know. So that's a little bit about the physiology of diabetes. Next week, Dr. Hundel, our endocrinologist, is going to talk more about diabetes in general. We're going to turn more to food today. So type 2 risk factors. Who's at risk of getting type 2? Weight gain. And I do want to say that not everyone who is overweight is going to get diabetes. 30% of people with type 2 diabetes are actually normal weight or underweight. But certainly weight gain can contribute to, especially if you also have the other risk factors, which would be an inactive lifestyle, ethnicity. Certain ethnicities are more prone or more likely to have diabetes. A history of gestational diabetes, so diabetes in pregnancy, and family history. So if mom and dad have diabetes, then you are more likely to get it and want to be proactive in taking care of yourself. So what raises your blood sugar? We're going to talk about all of these in detail in the next several slides. So the type of food that you eat and really the quantity of the food. So we're going to talk a lot about carbs. The quality of the carbohydrate, the quantity of the carbohydrate, and what else you eat with the carbohydrate. All of those things contribute to raised blood sugar. So what are carbs to start before we talking about what they do to your body? And a lot of people know, we think about bread, or we think, oh, I can't eat bread. Bread is carbs. And it's true, bread is carbs, but yes, you can eat bread unless you're allergic, then please don't have it. So grains, rice, pasta, wheat, bread, rolls, quinoa, couscous, bulgur, flour, cereals. So any of that green, cereal grain product. Starchy vegetables, potatoes, corn, peas, winter squash, so not zucchini, not yellow squash, but butternut squash, acorn squash, pumpkin, that type of squash. Fruit, all fruit is a carbohydrate, and all fruit can be eaten with diabetes. Milk and yogurt. Cheese is a protein, so cheese is really fat and protein. It doesn't have lactose in it. It may have a very little amount, but not enough to be considered a carbohydrate. But milk is a carbohydrate, as is yogurt. And then anything with sugar. So ice cream, cookies, cake, muffins, donuts, candy, all of that is carbohydrate. Kemal, I'm not moving on for some reason. Thank you. So quality of carbohydrate. Where is this important? This all has to do with the rate of the digestion. So if you are eating a very processed carbohydrate, think about something like Lucky Charms, think about Wonder Bread. That's going to be digested really quickly. There's nothing in it to slow down. There's not a lot of fiber. So it goes quickly through you. Blood sugar goes up pretty fast. If you eat something that is a less refined carbohydrate, that would be something like fruit, something like starchy vegetables in their natural state. So not a French fry and not a potato chip, but something like a little potato with the skin where you're eating the whole thing, something going to be a little bit slower to digest. Bulgur, quinoa, farro. So think about grains, least processed, things that take longer to cook. Slightly more refined. Then we get into ground grains. So think about something made into a flour. So that would be whole wheat flour, whole wheat pasta, anything made with whole wheat flour, brown rice, and some cereal grains. So those are going to affect blood sugar a little bit faster than those less refined carbohydrates. And then refined, white bread, white flour, sugar, any kind of sugar. A lot of patients will say to me, well, I stopped using white sugar, I only use honey. And while honey does have some other benefits, it's still sugar. So it still makes blood sugar shoot up pretty fast. Sugary cereals, cornmeal is pretty refined, as is cream of wheat, because they just don't have the fiber in them that those whole foods. Now, you may notice that vegetables are not on the list. Vegetables technically have some carbohydrate, but mainly their carb is fiber, and they're otherwise water, vitamins, and minerals. So when we talk about counting carbs, we really only count starchy vegetables. We want you to eat a lot of non-starchy vegetables, lettuce, tomato, onions, cucumbers, carrots, all of them. But we don't necessarily count them in as affecting blood sugar. In fact, if anything, they're really good for blood sugar. So quantity of carbohydrate. Too much food, regardless of what you eat, is going to raise your blood sugar. So fruit is something that's very good for all of us to eat. 2 to 3 servings, 4 servings, 2 to 3 for diabetes a day. But if I eat a cup of grapes, 10 grapes, that's not going to affect my blood sugar. However, if I eat a pound of grapes, that is going to affect my blood sugar. So people with diabetes do have to be careful how much they eat in one sitting. If you think about ordering Chinese food, it may be vegetables and sauce and not a lot of carbohydrate, but it's often a very big portion, and that is going to raise blood sugar. So how do you know how much is for you? Everybody is different. So if you're somebody who's sedentary and you're on the smaller side, you do not need as much carbohydrate as somebody who is bigger and very active. So how do you figure that out? Certainly working with a dietitian, somebody like me, or other dietitians can help you get that number. Remember, your brain and nervous system only use carbohydrates, so you do want to have some. 40 to 50% of your calories should come from carbohydrate. And that you have to figuring out your calories, again, depends on age, weight, activity, and your goals. What do you want to do with your weight? So if you have a calorie goal, you can do the math. So my example there is if I eat a 1,600 calorie diet, 45% of that is 720 calories. There's 4 calories in 1 gram of carbohydrate. So I do 720 divided by 4, and I get 180. And that tells me I should have 180 grams of carbohydrate per day, or 45 grams per meal and 15 to 30 per snack. Now, if you think, well, that's a lot of math, using apps like MyFitnessPal or free apps, Lose It, that you can do on your phone, they'll do the work in grams for you. And then we're going to talk about the plate method too, which is an easier way if you don't really like to do all this math. So the last thing that really affects blood sugar is balance, is if you eat carbs all by itself. So foods are digested differently. Again, the quick, the most refined are digested the fastest. So if I drink juice, that's actually digested in 15 minutes. If I eat cereal, it might be 30 minutes. But if I eat a whole grain carb, I can go all the way up to 2 hours to digestion. Protein is 4 to 6 hours to digest. Fat can be all the way to 9. So if I eat something alone by itself, not meaning by myself, but if I eat the food by itself, I eat it as pretzels or I eat some cereal, nothing else with it, it's quick digestion. If I'm going to go for a run, it's really good energy because I'm going to get it right away and I'm going to feel great with my run. So blood sugar goes up quickly, my insulin kicks in, and my blood sugar drops. So if I'm not going for a run and I'm sitting here working and I've eaten this dry cereal, something sugary too, like Golden Grams, so now what's going to happen is I have this quick energy, and an hour later, my insulin's kicked in, my blood sugar drops, and now I'm tired. So you don't want to have that spike. You want to have a nice, slow, and steady rise to your blood sugar. So how do you fix that? Ideally, you don't eat Golden Grams. So we pick a better breakfast. And maybe let's throw in oatmeal, which now has fiber and protein added. So I've added in fiber, which is also slower to digest. That's more the 2-hour carb than the 30-minute carb. And I've added in protein. And I could put some walnuts in there too to add in some fat. So now I've added in a mix of nutrients, and I'm going to have a slow and steady rise and fall, which is going to give me energy later on. And you may have seen commercials, even things that are not so healthy, like Snickers. They talk about giving you that extra energy packed with protein. That's not something I'd recommend to eat to do this, but if you think about a balanced meal, so apple and peanut butter, rather than just having the piece of fruit by itself, or just instead of just having toast with an egg or toast with peanut butter. So always having that combination. And the example that I give of digestion on the slide is an apple versus applesauce versus apple juice. So apple juice is refined, there's no fiber. It's going to break down very, very quickly. So if I drink just a little cup, 4 ounces of apple juice, this is going to raise my blood sugar in 15 minutes. It's quick. If I eat applesauce, it's broken down, but not quite as much. So I have some intact fiber in that. So that's going to take more 30 to 60 minutes, whereas an apple can take up to 2 hours to digest. So it goes back to that quality too of having that whole food. And then I add fiber, fat, protein to it. I add some peanut butter with it. There's some cheese with it. I'm going to have really good blood sugar. All right. So our next step is how to keep your carbs in check. So I addressed MyFitnessPal calorie counting app is a really good one to show you what you're eating. So if you think, well, I don't know what carbs are, I don't know what fat is, I don't know what protein is, I'm not sure how to do this, you enter your food in, it's a free app, and it tells you. So you might think, well, I'm a really healthy eater. Oh, I didn't think the Chick-fil-A was so bad for me. When I put it in, what can I do to eat something that's better? There's also exchanges. So you may know grandparents with diabetes, parents with diabetes, when they were diagnosed, they were told to eat so many carbs per day, so many fruits, so many vegetables. And those, if you look up diabetes exchanges, if you Google that, you can get those numbers. Those are all out there. You can use an app, you can use a notebook, you can use a book just to look things up. CalorieKing.com. Calorie King is a book which we carried around for years. We used to give it out to patients when I first started working, before everybody had apps. And the easiest way, though, is the plate method. So if you think about what your plate looks like, and then you've probably seen pictures making half your plate vegetables. So if you only have a quarter for carbs and a quarter for protein, you're not going to have too many carbohydrates on there, and you're getting in all your vegetables. And so what if you think, well, I like my salad on a separate plate? How do I figure that out? So sometimes we use our hands, we use our fists. So if you think about the size of your protein being about the size of your palm, your carbs, a fist is about a cup, so they should not be bigger than this. and then half your plate for your vegetables. So you want to have 2/5. Now, I usually have somebody say, well, my hands are really big or my hands are really small. So you can always measure then to do that. If it is, they say a lady's fist, but some ladies have smaller hands and some ladies have bigger hands. So measuring out a cup to see. But if you use that ratio, if this is your carbohydrate, your vegetables should always be double. So that's going to give you that extra fiber to help keep blood sugar in check. So meal ideas, what do you eat? So now you know how to fix your plate. Where do you get these food ideas from? I really like, there's a blog and a cookbook called Skinny Taste, skinnytaste.com. She has a lot of good recipes. There's also a lot of free recipes online. So there's magazines that you can subscribe to, Cooking Light, Eating Well, but they also have recipes online. The American Diabetes Association, which is diabetes.org, they also have a lot of recipes and meal ideas. And then you need to meal plan your week. So let's say you think, all right, I need to have vegetables every day for lunch and dinner, and I need to have fruit every day for breakfast and lunch or lunch and dinner. So if you only buy 3 bananas and a bag of spinach, it's not going to last you the whole week. So you have to think about, all right, if I'm going to eat a big salad every day, I need enough vegetables to last me. So going through your cabinets, what do you have, making your list. You need to have some kind of protein. So you're going to eat peanut butter, you're going to eat Greek yogurt, cottage cheese, animal protein. Buy it, plan it out. What starch goes with the vegetables? So if I'm going to cook chicken, maybe I'm going to have a sweet potato and some frozen broccoli, and I've got a meal right there. Because what happens when we don't plan our meals? Usually then we're on, right, ordering something out because I don't have any food and I haven't thought about it and I don't want to cook. So when that happens, we don't always eat so well. Think about the last meal you've had out that wasn't a salad. Did it have a lot of vegetables with it? Probably not. And the last meal that you've gotten out, or the last several meals you've gotten out, was there fruit with it? Probably not, because it's hard to get fruit out. You might get a fruit cup and it's not always very good. So if you have those meals planned, you're going to eat much better. So some more meal ideas. Consider again a session with a registered dietitian. It's something that we do like to do, is give meal ideas. We all like food. Well, I don't know if we all like to cook, but we like to talk about food. So giving you some ideas of what to eat. And then trying new foods. So fruit is really good right now because it's summer. So trying some different vegetables that are growing, trying some different fruits growing. If it is winter, trying some different root vegetables that you haven't had before, like turnips or parsnips. And if you buy one, and if you don't like it, that's it, you've tried it. Try new grains that you may have never had, some of the ancient grains like bulgur or quinoa or farro. And then one pot meals can be really easy. So in the summer, it might be a salad. It might be some protein that you've grilled ahead of time. In the winter, you might saute vegetables in olive oil and then add in some cooked protein and some starch. So just that handful if you have it cooked ahead of time. Easy to go. Easy to do. You can saute onions, peppers, an example, add chicken, black beans, corn, and there you've got a meal all together. Or eggplant, mushrooms, and garlic. If you're doing a vegetarian meal, you can add some farro, some fiber. There's your carb. Add some cannellini beans for your protein. And pesto, you've got a healthy fat, and you've got a quick meal right there. Of course, you've had to grill the vegetables first. Some final quick meals. Think about lunch bowls. One of my favorite meals are these bowls that we're seeing a lot out if you've been to Roots or Poke Bowls. So think about your base being a lot of vegetables, 2 cups of vegetables, a little bit of green, a little bit of lean protein or beans or tofu or fish, and then your toppings to tie it together, which could be pesto, hummus, salad dressing, tahini, a lot of good things. And you can make those ahead of time. Just don't put the toppings on first, and then they'll last you through the week. So there's some more ideas on there, but you want to look at that plate. You want to think about 2 cups of vegetables with each, well, with lunch and dinner, maybe not with breakfast, half a cup to a cup of starch, or half a cup of starch with fruit and 3 ounces of protein. Why those numbers vary, why it might be a half a cup to a cup, because again, everybody has different needs for how much they need. So eating with diabetes is normal eating. If you have diabetes, you don't have to be on a special diet. We want you to be on a healthy diet. So it shouldn't be on a Lucky Charms and macaroni and cheese diet. It should be really healthy food with fruits and vegetables, lean protein, whole grains. Low in saturated fat, we want to keep your heart healthy. Low in refined sugars to keep your heart healthy, and ideally enjoy it. All right, and that is the end of the nutrition section. So thank you very much for listening, and we'll turn it over to Jackie.
Well, thank you so much, Amy. So I will go to the next, and Jackie, you are on.
All right, hi everyone. My name is Jackie Tomasetti. I am the Behavioral Health Program Director here. I want to talk a little bit about understanding your emotional wellness and how it connects to our physical wellness, because we can't be emotionally well as being physically well. So the stress and strain of diabetes management can lead to our increased depression and anxiety. So some things that we can do to manage this stress is positive self-talk. And what I mean by that is helping our bodies and our mind understand that it is okay to be stressed out. So in order to do that, when we get stressed out, we have to be able to talk ourselves down. We have to be able to understand that it's okay to be stressed out and have our body allow ourselves to understand that. So we have to calm ourselves down. We have to tell ourselves, okay, Jackie, I know that you're stressed out. I know that you're freaking out right now, but it's okay. You're going to get through this. I know that you can do this. I need you. I know that you're here. I need you to bring yourself down here. You got to be able to positively talk yourself down. And I know that sometimes that's really hard, but sometimes we are our own best self. So we have to really be able to talk to ourselves and really bring ourselves down, because sometimes not everybody else can bring ourselves down besides ourselves. So we also have to understand our strengths and our weaknesses. And just like Amy said, if we know that Chick-fil-A is a weakness for us, we can't necessarily always drive past the Chick-fil-A and stare at it and know that it's a weakness for us. If we know that we love Chick-fil-A, then we can't sit there and stare at it and say, okay, well, I know that I really want it today, but I know that I can't get it. So if we know that that's a weakness for us, then we can't sit there and stare at it. So we have to be able to understand what our strength and our weaknesses are. So we have to be able to understand our physical strengths and our emotional strengths at the same time. If we know what they are, then we're going to be able to manage our physical and our emotional strengths at the same time. So being able to understand what is okay and what is really hard for us at the same time. So if you know that Chick-fil-A is a strength for you and you know that you're going to be able to bypass it, then that's okay to drive past that way. But if you know that that's going to be a really hard drive for you, then maybe you should go the long way around. And that may be a 10-minute drive further, but at the same time, it's going to be an easier drive for you, because maybe you're going to pass Salad Works on the way home, if that makes sense. Because sometimes we need to be able to be, once again, our own best self, and understanding our strengths and our weaknesses is really, really key in being able to manage our physical and emotional wellness. And socialization is really also key, because when we also have friends in our group that are going through the same exact thing, it really helps us. So, you know, teaming up with other friends that are going through the same exact things that we are can really help as well. So, you know, being people that have the same likes and dislikes as us. And just like Amy says, it doesn't always have to be on the same diet that we're on. It doesn't have to be a diet. It's just healthy eating. So if you have a friend who is always going out and not doing the best thing for themselves physically and mentally, maybe they're not the best friend to be hanging out with at that moment in time when you're trying to do the best thing for yourself. So you need to make sure that you're aligning yourself with the best person for you, because if that person is going to be going out and eating fast food every single day, and you know that's not the best thing for you, then that's not the best person to align yourself with. So we really need to make sure that we're doing the best thing for ourselves. And just like Amy said, there's a really great online community, and there's online community for us to socialize with too. So there's online community for people who have diabetes, as well as who have depression, anxiety, and things like that too. So there's a huge online community of people that are searching for people to connect with. So there's a lot of people out there who are searching to connect with people who are feeling the same exact way. There's also a lot of online techniques that you can use called mindfulness, and that really helps bring down a lot of stress and anxiety that people feel sometimes. I know a lot of people feel really overwhelmed with everything that's going on, especially right now with COVID-19, a lot of people feel out of control emotionally. So, you know, mindfulness is a lot of deep breathing, a lot of techniques about being one with yourself. So there are a lot of research out there that you can also do to help yourself understand what it is to bring your physical self and your emotional self together, which can really also help you understand how to combine your emotional self and your diabetes together. So realizing, tying into when it's understanding how to reach out for professional help is also key, because sometimes when we become extremely overwhelmed and we can't manage it ourselves, sometimes we need to reach out for help. And it's really okay to reach out for help. You know, just because reaching out for help, sometimes people think of it as taboo and think of it as a bad thing, but just because we reach out for help doesn't mean we're bad people. It just means we need a little bit more help sometimes.
United Medical has a website, a YouTube. Well, we have a lot of activities on social media, but the educational videos are available on the YouTube channel, and we will. I'm just going to go through this very quickly for you. So our nutritionist and our social worker, they did some videos already. So these are extremely useful resources for our patients. Now, I have to tell you that, Amy, when you were going through your presentation, I guess it has something to do when we really listen. So, like, because sometimes like we are just a passive audience for these, and I'm like, am I paying attention or not? And every time I pay attention, I pick up more stuff. I don't have diabetes, but I can see every once in a while we struggle from the weight gain, and diabetes is correlated, of course, with that. So, like, I picked up a couple things from this, although I have seen this before. It can only be useful for those patients. One of the things that I'm actually maybe discovering these days more and more, or realizing or understanding, we really don't pay attention. So in some cases, when we are presenting, or when we have these meetings or these visits with our providers, with our physicians, or with any of our providers, I think we really don't pay attention to what they are saying, perhaps in some cases. So what I'm suggesting is that pay attention to what we are presenting, understand what we are saying, why we are saying it. We are out here, and I do really appreciate the time that you guys are putting forward. It's at 7:40 p.m. And we don't have any commercial gain from this. So we do this for our existing patients. This is an outreach for patients who may be struggling at home, or who may not understand certain things, and then they can go back and watch. I'll make this video, my team will make this video available on our YouTube and on our social media pages. Please take advantage of this. This is something that we are going to start doing more and more. There is an event coming up this Friday at noon. That event, actually, I do usually have one guest with me, and we discuss corona-related issues, patient portal issues. Now, on this side, you'll be able to see from the quick tips to the behavioral health support, to how to wash your hands during the corona time. So these are very beneficial resources. Hopefully you can take advantage of these, and also let us know what else can be done. Now, in our so sometimes, like, I feel kind of wrong if I don't mention everyone. We have 2 other dietitians in the program. In fact, Fran is listening this on the audience, and we have Beth who joined us a little more than a year ago. So, and we are trying to increase these resources and availability of our resources for the patient, and hopefully everyone finds these helpful. So now, Donna, anything you would like to add? Or any?
I did. In addition to the videos, Kemal, would you be able to just bring up our regular United Medical website? So I was thinking if we could show them our wellness program for diabetes. In addition, we also have the quick tip videos there, but we have some other resources that I thought it's one thing if we hear it, and a lot of people like to see things in writing. So out here on our web page, if you click on the diabetes, we have a lot of resources here. So in addition to being able to see our full team, we have educational handouts that our dietitians have spent a lot of time, and some of those things may be helping you with your shopping list, or helping you with other meals and things like that. And then again, we have the quick tip videos. The links are right there that take you to the YouTube channel. So there's a lot of resources here. And then as well on the behavioral health, which is another one of our programs in that original diagram. If you click on there, we have Jackie's videos are there as well. And then you can also find some other resources if you're looking for, like community types of resources out there.
So I don't know if you mentioned in the beginning, but our program is accredited by the American Association of Diabetes Educators. So this is our year 3, right, Donna? Or
actually, we have been accredited since April of 2016. So we just went into our 4th year. So we did submit everything into our second set of, I guess, 4 years back in April.
All right, so I'm going to actually stop sharing my screen so then everyone can see us on the full screen in case.
And then if anyone has any questions, we'd be happy to answer those. I know we have a couple of questions that we get all of the time that I thought I would pose. It might prompt some other questions. What about low carb diets like keto? I know that's a question that our dietitians get a lot.
We do get that question a lot. Keto is the last couple of years, it's sort of the big fad, the big diet, and we don't recommend it. No, I mean, one of the things I spend a lot of time talking about fruits and vegetables. Any diet that says fruits and vegetables are too high in carbs is not recommended. When your blood sugar is high, your blood is sticky. So you're more likely to have heart disease. With every 1% that your A1C is elevated, that's a 10% risk increase of heart attack or stroke or a vascular event. So if you're eating lamb and sausage and bacon all day, you're not helping your heart, and you're also not helping your blood sugar either. So we do not recommend keto. I will say personally as a dietitian, I've never had everybody loses weight on keto, and initially their blood sugar goes down, but either what happens is they start having kidney stones or other problems, or they just crack because they really miss carbs. And then their blood sugar shoots up. So they've actually studied people who did keto and then went off of it, and they found that going on a really carb diet and really cheating is actually worse for you than eating a moderate level of carbs in the beginning. So no keto, no really low carb. We know that populations who eat fruits, vegetables, beans live the longest if you've looked at the Blue Zone studies. So people who are eating meat all day, I'm sure there's some people, just as we know some people smoke and eat bacon up to be 100, but they are outliers. So they're good beans, those people. Any other questions you have for us? Or do we have any questions out there?
Well, Kemal's looking there to see if we have any in the chat box. So if you do have a question, please feel free to go ahead and chat with us. There's a box here that you can type in your question, or you can use the raise hand feature, and we'd be happy to unmute your line so you can talk to us live. While we're looking,
I do want to remind everyone that our next event is going to be on August 26th. Dr. Ripu Handal from First Aid Endo, who's also our program director, will be joining us at that point on the 26th. That's going to be again at 7 p.m. Now we picked 7 p.m. The other thing is it's not set in stone, so we are trying these things to see if any other time would be helpful. Thinking that 7 p.m. is kind of everyone's kind of settling at home, but we are going to try to do it in different times if it doesn't work out. But since we are going to make them available offline on our YouTube and other accounts, so you can watch it at any other time.
And Tim McHugh, who is a physical therapist in our physical therapy group, will also be joining Dr. Hundle to talk to everyone about exercise when you have diabetes, and when you should eat, when you're before and after you're exercising, and what are good types of exercises to do, and how that will impact your diabetes. So we're looking to bring on a lot of people to help give you what you're looking for. But if you have any ideas, or if you're looking for anything specific, we'd love to hear from you.
All right, well, since we are going to
I think Kemal may have frozen.
Oh, no.
So I think what he was going to say is, since we don't have any other questions, we're going to have this available online. We would like to hear from you, and please tune in next week when you can hear from Dr. Hundle and Tim. And thank you all for joining us this evening.
We do have, our Facebook page, our wellness group page. So if you have other questions and things that you want us to talk about, people that you want, you can also put them on there.
Absolutely. Thank you, Amy.
Thank
Yes. Good plug for that. So thank you everyone for joining us, and we look forward to seeing you again.
All right. Thank you.